Hello, everybody. This is Gary. Today is February 11th, 2022. It is 1:29 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I just wanted to do a quick update. I didn't make a video yesterday or the day before because my paranoia was pretty intense. I thought people had broken into my apartment and switched my property around to try to drive me crazy. I was very paranoid that people were spying on me, um, trying to damage me, harm me in some way. That they snuck into my apartment somehow and changed things around. Um, Most of that paranoia has passed, but it was pretty intense and it was pretty uncomfortable. Um, it's one of the worst psychotic episodes I've ever had. Um, it reminds me when I used to believe that I was being gang stalked, but I wasn't being stalked. I was just being paranoid. And the same thing happened yesterday, the day before that. Um, I was not thinking clearly at all yesterday and the day before that, so I never got around to making a video. Um, but other than that, I'm doing better. My psychosis is under better control. My anxiety today is under better control. Um, my paranoia is under better control. Depression is under better control. My auditory hallucinations intensified yesterday and the day before that, but I'm doing better. My auditory hallucinations are at a baseline. I'm pretty low key today. I just also wanted to do an update on the fact that I'm taking the antidepressant Cymbalta for physical nerve pain and muscular skeletal pain that I've been having for the past 5 or 6 weeks. I've only been on Cymbalta for about 5 days. I'm on 60 milligrams once a day, and it takes time for it to build up and have any effect in controlling my physical pain. So it's too early to tell whether or not it's been successful in controlling my nerve pain and my muscular skeletal pain that I've been having and my joint pain. I went to my primary care doctor. I definitely have arthritis in various parts of my body, and I also have bone spurs, so that's causing some of the physical pain. And I have an appointment with an orthopedic surgeon on March 2nd. I don't know if I'm going to need surgery or not. I'm just consulting with this doctor. There's no indication that I'll need surgery at all. Um, but as far as the Cymbalta goes, I have had some side effects. It seems to overstimulate me, and I've had a problem with insomnia for the past 3 or 4 days since I started Cymbalta. But I'm hoping that'll die down over time. Feel a little, I don't know if the word's agitated or just overly physically. I wouldn't say I was manic, but I'm definitely physically more on edge and more energetic. Um, Hopefully that'll pass as I continue to take the Cymbalta and get used to it. Um, but it's too early to tell if it's doing anything for my physical pain, which is why I'm taking it. Cymbalta is an antidepressant. It may help control my depression and my anxiety, but that's not the primary reason I'm taking it. I'm taking it for physical nerve pain, pain in my joints, muscles, and my nerves. And we're not even sure what the cause of that pain is. I'm also taking Flexeril for muscle spasms and pain, Tylenol for arthritis pain, and Rotten for the physical nerve pain as well as the Cymbalta. Um, so I'm on several medications, And I'm also doing physical therapy with a physical therapist to help control the physical pain, various exercises and stretching exercises, and physical therapy exercises that I do every day. I'll be seeing a physical therapist again on February 14th, which I believe is this upcoming Monday. I have psychotherapy group on next Tuesday, and I believe I'm seeing my psychotherapist sometime next week, and I'm seeing my psychiatrist in about 5 weeks. I just saw him last week, and I suggested the Cymbalta for the physical pain, and he said if it was going to be prescribed for physical pain, that he would prefer my primary care nurse practitioner prescribe it, and she is in charge of prescribing it. Since the main reason I'm not taking it is for depression and anxiety, but for physical pain. Um, uh, but overall, I'm doing better today than I was yesterday and the day before that. Um, it's been rough over the past few days. Uh, Lack of sleep, paranoia, delusions, intensified hallucinations. I did go to the psychiatric emergency room. It wasn't necessary to do that. I wasn't feeling suicidal and I wasn't feeling violent, so I didn't go to the emergency room. But it's been an uncomfortable past couple of days.